remember when my daughter, Kara, who's now 27, when she was 4 years old, I took her to a boot camp at Health Quest at a workout place, because I was working out in the gym and she was working out in the boot camp, and she came out, picked her up from the boot camp, and she called it boo-boo camp, and she said to me, "Why don't these parents love their children?" And I said, "Of course they love their children. What are you talking about?" And she said, "Well, they're giving them marshmallows and candy corn out of boot camp, in boo-boo camp." And I said, "Well, that doesn't mean they love their children. They just don't know that what we know, that what you eat makes your body, that what you eat makes who you are." And she said, "How could they not know that? How could they be so stupid?" And I didn't explain to her then, or I couldn't. She was too young to explain this concept of cognitive dissonance, that the body works to push out of its forefront of thought the idea that every mouthful is hurting you or damaging you. Your smoker isn't thinking of how bad they're trying to cognitive dissonance. They don't want to create anxiety. So the primitive addictive brain, and every American has this addictive brain. Their brain is a brain of addiction. They've been fueled to think like an addict, which blocks out of their conscious thought how that they're hurting themselves instead of helping themselves with their behaviors. And they think if they can eat a bagel or a pizza or a donut with a cup of coffee, then they're not thinking they're killing their kid when they give their kid a donut hole or a candy corn after coming out of boot camp or at gymnastics or coming off the soccer field. The kid stands there with a mitt in their field, playing baseball, hardly even doing any exercise, standing out in the field. They come up the field, the parents are giving them donuts and cheese doodles. It's the craziest thing in the world. My kids always used to say, "What? Why are the parents doing it?" I could see why a kid would want to eat junk food, but why would a parent be purposely pushing it on them? I'm saying I don't know. It's it's crazy. It's like if you woke up in the morning and every kid was smoking cigarettes in a schoolyard, and on the swing set they were all smoking, and every parent waving to the kid about the bus stop was smoking. All the babies in the baby carriages were given cigarettes to be smoking, and it's like you would think nothing's wrong with smoking because everybody's doing it. We live in a totally crazy society. So fast food's lower IQ, and the regular consumers of fast foods have the worst outcome. And of course, fruits and vegetables in infancy related to increased intelligence. And fast food consumption by the parents of childbearing age, particularly by the mothers of childbearing age, increase the child's risk of autism and birth defects and heart defects. And you know, of course, about this craziness about women taking folic acid in their pregnancy to prevent neural tube defects. You've heard about that, right? Why would a woman have to take an artificial synthetic ingredient made from petroleum to prevent a neural tube defect? To get folic, it's the stupidest thing in the world. Because folate is high in produce and high in green vegetables and beans. Your folate levels are high as anything. Not gonna, if you're eating a normal diet. Of course, if you're not eating any vegetables or beans or greens, you're going to be low in folate. So instead of telling a person that they better eat some vegetables if they want to have a healthy children, we don't tell a person to eat a healthy diet or eat vegetables to have a healthy child. We say to them, eat fast foods and just take a folic acid pill made from petroleum. And folic acid isn't like folate in real food. It's an artificial substance. It's absorbed too rapidly. It increases risk of breast cancer and other cancers. So the folic acid pill you took during your pregnancy increased your risk of breast cancer and increased your child's risk of breast cancer to prevent neural tube defects and of course, your child's risk of autism and of having other birth defects, and your child's risk of autoimmune diseases and brain tumors and acute blastocytic leukemia. Let me say that one more time. The leading cause of death in children, other than accidents, is childhood cancer, like acute blastocytic leukemia. And childhood cancer is linked to the diet of the mother, not just during pregnancy, but prior to conception, particularly the lack of green vegetables in the diet. And consumption of luncheon meats in the mother's diet are linked to increased risk of children with cancer or brain tumors. And instead of educating the population about women of childbearing ages to be eating vegetables and not eating processed meats, instead of doing that, we say nothing about that, and we give them a pill for folic acid, which causes cancer. Is this the craziest thing in the world? And I'm the only person arguing or discussing this issue practically. I discussed this issue back in Disease Proof Your Child, which I think I wrote about 14 or 15 years ago, and there's still nobody discussing it. It's like giving your kids whiskey and cigars as they're playing poker around the table.